Just to give you a little bit of background, Sparta is a rural community about 30 minutes north of Grand Rapids, Michigan, and it's an area surrounded by apple orchards and strawberry and blueberry and all kinds of fruit. And so during the summer months, it attracts a large migrant population. The Sparta Health Center is affiliated with Mercy Health St. Mary's, which is the hospital in downtown Grand Rapids that works with all patients but also has a special mission to serve the poor. Both the mission of the hospital and the mission of the people working at the Sparta Health Center made my job really easy because even though they may not speak specifically about Catholic social teaching, I see a lot of the values and a lot of their comments as very in tune with caring for the underserved. For me, Catholic social tradition is really what brings together the academics and the heart of my studies. I hope to be a doctor, and I hope that this video shows a little bit of how I hope to use my Catholic faith and my own interests and skills to serve. So what does Catholic social tradition have to say about healthcare for migrants? I used two Catholic social tradition documents released by the United States Conference of Catholic Bishops, Strangers No Longer, which talks about migration, and Ethical and Religious Directives for Catholic Healthcare Services, which is about healthcare. Here's what they had to share. 1. Persons have the right to find opportunities in their homeland. 2. Persons have the right to migrate to support themselves and their families. 3. Sovereign nations have the right to control their borders. 4. Refugees and asylum seekers should be afforded protection. 5. The human dignity and human rights of undocumented migrants should be respected. In accord with its mission, Catholic healthcare should distinguish itself by service to and advocacy for those whose special condition puts them at the margins of our society and makes them particularly vulnerable to discrimination. The poor, the uninsured and the underinsured, children and the unborn, single parents, the elderly, those with incurable diseases and chemical dependencies, racial minorities, immigrants, and refugees.
Went to school at the University of Notre Dame and was a pre-med. Instead of going right on to medical school, I decided I would do some sort of service work. Fortunately, at the time, they offered a program called the Holy Cross Associates. They offered a 2-year program in Chile, and I applied and I was accepted for that. When I came back to the States, and I went to Virginia Commonwealth University Medical School, and I got to know a lot of patients who spoke Spanish. There were very few people in the hospital at the time that spoke Spanish, particularly providers. Mm-hmm. And I realized, again, dealing with a lot of people, they really weren't sure what was going on. They kind of had an idea, but they certainly weren't able to participate with their own care, and certainly weren't able to get the kind of education that we would hope for if we had some sort of illness, mm-hmm. to help us get better or to help prevent a relapse or help us just be healthy in general. So that kind of led me to want to work at a place like this once I got through my residency.
When I got here and I was doing it for a little while, I just kind of felt like this was like a calling, like a niche for me, and I just felt like, no, this is it. This is what I want to do.
I was a migrant farm worker myself, so we migrated back and forth 14 years. The reason I got interested in working for a health center is I started off working for migrant health promotion, and basically it was here in Michigan and in Florida, but It was a program where you were still a migrant farm worker, you still worked out in the fields, but you had this other, it was kind of like they would pay you a stipend, so it wasn't a whole lot, but to educate yourself a little bit more and talk to people out in your community. So I really love that.
Well, language is an obvious one. Not so much with our particular office. Most of us here speak Spanish and English, but if we want to send them to a specialist or if they need to get care through an urgent care, emergency department, that type of thing.
Obtaining preventive health care services for people who live way out here or people who have insurance is also, really difficult. And even with people who have insurance, it's there's no bus that comes up here. And the other is just financial. A lot of people are here illegally and don't qualify for some of the health insurance products.
In Michigan, there's a Medicaid program, and in Florida, they have a different Medicaid program. And so when you move to state, you have to close your case, open your case, and things like that. So,
Okay.
yeah, it doesn't move with you.
So potentially someone would have to open 2 cases every year and close 2 cases every year if they're going
Or
back
more.
and forth. Or
Yeah,
more.
because,
Okay.
if
If they
people...
are in more than 2 states.
And a lot of people do, they really
Yeah.
do migrate more.
Uh-huh.
Yeah, if you migrate to 2 states, it's, you think, consider yourself blessed. It's difficult because being a migrant farm worker and just moving around, you're never sure of exactly where you're going to be regarding, housing, work, if there's, when work starts, when you get there. So we found it difficult when you're a migrant farm worker. If it rains, you didn't work, and so there was, no money that day. So, and it's like, if you got sick and couldn't go to work, there was no money that day. We're really touchy-feely. I mean, we like it, when you, say hi to our kid, tap them or whatever. We like it when, of course, you speak Spanish, so that's really helpful.
I find they're quite a bit more religious in a lot of ways than a lot of our Caucasian patients. There is a big emphasis on what you said, family, and they expect what everybody else wants. They want you to care. They want you to try hard to help them, and frankly, they need somebody to give them a little boost.
I think the big thing is talk to patients, get an idea of what their healthcare beliefs are. For example, we have a lot of patients who will bring their children in because their children are grinding their teeth at night, and I learned that oftentimes to them means that the child might have intestinal parasites or something like that.
A lot of times they also will schedule themselves for a physical.
Okay.
Because they know something's wrong, they have some whatever symptoms, but for whatever reason they don't quite understand that there's a difference between like a problem focused visit and a physical.
I feel that a lot of the people that didn't have insurance now have insurance and have that access now. In Michigan, before the whole, marketplace, Obamacare is what they call it, before that, it's like if you weren't disabled, pregnant, or had kids, basically you couldn't get Medicaid. We go to all the different camps in the area. There's probably like more than 100 here. Yeah, we go door to door and, like I said, give them information, and also we have a nurse and she goes out and does blood pressures and glucose and tries to answer questions as much as she can. Doing outreach and getting out there and, informing people of health and healthcare and where to get it, I think is really like a plus.
I think I'm pretty fortunate. I found my vocation.
I was a farm worker. I did the work. I was out there wet and, rainy and cold and, freezing hands because the asparagus was so cold. So the experience to actually experience it, it hits you in your heart because you've been there, you've done it, and so it makes you. It makes me like understand more and have this compassion. The reason I feel that I work here too is because I was there, know what it's like, went through the struggles, and now I can empower and help other people. It's been rewarding. Like, I like what I do. I actually love what I do, and I actually tell people that I love what I do, because Mercy Health is, a Catholic organization, and they really, put that into you, the mission of the hospital, and it's so cool because you get to. The mission is actually to serve, the underserved.